Hi, it's Gary Chimes from Lake Washington Sports and Spine, and I'd like to talk about biomechanical engineering from the perspective of a physician. So for somebody like me who takes care of people with musculoskeletal injuries, a lot of the principles that I use are actually from mechanical engineering. So mechanical engineering is a type of engineering that deals with load onto different tissues, often in the context of things like aluminum or steel or cement. And we're dealing with things like load, compression, tension, creep. And these principles are going to be true whether you're talking about aluminum or talking about bone. So it occurred to me a few years ago when I was taking care of a patient who was a mechanical engineer, why do we even need a separate field called biomechanical engineering? Because the concepts of load or tension are true about whether you're dealing with bone or aluminum. And from my perspective, the two reasons biomechanical engineering is a separate field is, first of all, that biologic tissue tends to be much more variable than other tissues. So for example, if I think about bone, there's much more variation from person to person than there are of sheets of aluminum that you would get from an aluminum manufacturing plant. And so a lot of biomechanical engineering is the study of mechanical engineering on much more variable material. The second thing is going to be the capacity for self-healing. So bone has a capacity to heal, aluminum doesn't. So what does this mean from a practical standpoint? So with the deal with the issue of variable tissue is that the science of biomechanical engineering is much more probabilistic than deterministic. And what I mean by that is if you apply like a certain load to a sheet of aluminum with a vector at a certain angle, what you'll find is that you can make a fairly deterministic assumption about what's going to happen. You can predict with a pretty high, like if you're trying to figure out when the tissue fails, if you bend a piece of aluminum enough times, you can probably make a pretty accurate guess. When you're dealing with musculoskeletal tissue, things are much more variable, and therefore you're dealing with probabilities. So if somebody's having an injury, like let's say they injured their Achilles tendon and they're trying to figure out when it's going to heal, we can't say it's going to heal in exactly 3 weeks. We might be saying an 80% probability it's going to heal in 3 to 6 weeks because you're dealing with much more variable tissue. So it's much more of a probabilistic science. So that's one factor. The second thing is going to be the capacity for self-healing. So if I'm dealing with somebody who has a musculoskeletal injury, if you have a piece of aluminum and it fails, like that, you can melt it down, but the aluminum doesn't heal itself. That's different than when you're dealing with the human body. If we're dealing with bone, tendon, ligament, these are tissues that can heal on their own, provided that you provide the right environment for healing, and that's going to be really important. So when we're talking about it from a physician standpoint, you need to create a healing environment. And what does that mean? Well, it means you need to sleep. You need to avoid things that inhibit healing, and we've talked before in some of our other videos about non-steroidal anti-inflammatories, things like ibuprofen and naproxen. They will prevent tissue from healing properly. You need to make sure you have a clean diet so that you have the appropriate nutrients for healing, and you need to make sure that you're providing a healthy stimulating load. And we've had another video talking about how different tissues have mechanoreceptors that help to stimulate the load. So from a physician standpoint, this is why biomechanical engineering is its own field, and these are the things that I'm thinking about when I'm taking care of patients. So I'm Gary Chimes, Lake Washington Sports and Spine.